Okay, the ARTAS system is an interactive, computer-assisted, FDA-cleared, and physician-controlled robotic system that's used for follicular unit extraction harvesting. This is a technique in hair restoration surgery that's somewhat novel. It's something that is becoming sort of replacing traditional hair transplant methods as we've known. Europe is significantly more advanced than we are, and in this country, still 72% of the providers are performing a strip-based surgery. The benefits of a follicular unit extraction technique are that it is a minimally invasive approach to extracting the individual hair follicles. This is done on an outpatient basis. Patients sometimes will come in and have little to no sedation. They may have a field block, which just means that we've given them a little bit of lidocaine, sometimes a little lidocaine jelly, similar to an Ambisol when a baby has teething. Then we follow that sometimes with a small injections of lidocaine like you would get at the dentist. And for those patients who are particularly more anxious, we can always give them a little bit of Valium by mouth or another sedative if we need to. That is something that we do on a case-by-case basis. Now, there are no more linear incisions. Okay, there's no more scar in the back of your head that goes from sort of ear to ear, or sometimes in some cases it even goes beyond the ears. So that is a thing of the past in our practice. Okay, we do not perform linear-based scar types of hair transplant surgeries anymore. If we are doing that, okay, if the only instances that we might do that is in a case of severe hypertrophic scarring, or where a young individual who laid down a lot of scar, young people do lay down scars very, very well. Sometimes they'll have hypertrophic scarring, or they just, for whatever reason, have a lot of tension on that scar. And so sometimes we'll go in with certain plastic surgical techniques to re-excise that, and if some collateral damage, we may be able to provide another few hundred grafts in that scar excision to help improve that scar. Okay? And so there's some multiple layer closures and ways that we do things that will improve that scar. We also sometimes forego that entirely. We just are able to sort of place individual grafts into the scar and make it almost completely go away. Okay, now there are also benefits with the robot with respect to the handheld devices. The robot, you are able to precisely, okay, and repeatedly, without any strain on the surgeon's lumbar spine, you're able to reproducibly dissect these grafts by the thousands at a time. And so that is somewhat of a superior approach by using this robot. Nearly detectable after 1 week, okay? Depending on the skin type of the patient. And those patients are of Mediterranean descent, perhaps of Hispanic descent, Asian descent, with a little bit more pigments in their skin. We're finding that they tend to have donor area that is almost undetectable at 3, sometimes 4, even 5 days. Extremely fast. But certainly by a week or 7 days, you should be almost undetectable. For our Northern European descent patients, or for people who are of Scandinavian descent, our Irish folks, they have a little bit lighter skin tones, Fitzpatrick. 1, 2s, 2s and a halves. Those are people who have fair skin. And so when you create these sort of micro injuries, because that's really what they are, you can have some persistent erythema or a little bit extra redness. And so that can be up to a week, and in some of those patients, it can go for another couple days, so maybe 2 or 3 days after that. But by far and away, at 8 or 9 days, the large majority of that redness and the noticeable effects of having a recent procedure are all but gone. Okay? Quick return to your regular activities as well. 1 to 2 days. You may not want to be playing racquetball or tennis or basketball or anything that really increases your heart rate or your blood pressure, because that can potentiate sort of bleeding in certain areas. We don't want one of the recipient sites to just spring leak, and if it would, it does do that sometimes, you just take your finger and you put it on the little place, and in 20 to 30 seconds it stops and you're fine anyway. but we don't like that to happen, okay? Well, sometimes can decrease the viability of the grafts, okay? And so those are the benefits. The results from this type of procedure are permanent, okay? This is not a, if you stop doing it, you're going to lose it. It's not the type of treatment modality that this is. These are definitive treatments for hair loss.